Good morning. My name is Chelsea Hedquist. I'm an Information and Communications Officer here at the WHO Regional Office for Europe. And I'm so glad to have you join us today for our Facebook Live, all about influenza vaccination, what you need to know about it. Every year, we face an influenza epidemic that puts strain on our health systems and claims lives across the European region. The influenza vaccine has been around for more than 50 years, and yet uptake in Europe is relatively low. As part of this year's flu awareness campaign, we've invited two leading experts to join us. They're here to take your questions about influenza vaccination. So we hope you will join the conversation here on Facebook. Send us your questions through the comments section, and we'll get to as many of them as we can in the next little while. Before we get started with questions, I'd like to introduce our two experts. First, we have Dr. Tyra Grove Krause of the Statens Serum Insitut. Tyra is a medical doctor, an epidemiologist, and works on influenza vaccination here in Denmark. And then we have my colleague, Dr. Dina Pfeifer, who is also a medical doctor with many years of experience in vaccine safety. So thank you both so much for being with us today.
Good morning.
Welcome. Tyra, if you don't mind, I'd like to get started with asking you a question. People often think of the flu as something that's not very severe. It's just a touch of the flu, nothing to really worry about. Can you describe to us, what does an extreme case of influenza actually look like?
First of all, I think it's important to know that you don't get an influenza infection every year. You may only get it maybe 2 or 3 times in a 10-year period. And it typically presents with a sudden onset of a high fever, muscle ache, and you will have a sore throat, cough, and really feeling very bad. You'll have a high temperature, up to 40 degrees, and often you'll have to stay in bed for 4 to 5 days, and even feel weak a long time after your infection, maybe several weeks. And even healthy adults and children, they can get complications like bacterial lung infections or ear infections. And if you have an underlying chronic illness, it may exacerbate your illness like COPD or heart disease. So it can result in hospitalization and maybe even death in severe cases.
Okay, so you're talking from the extreme of maybe 4 or 5 days sick in bed, which is still pretty severe for most of us. You know, most of us don't want to go down for that long, but all the way to the other extreme, hospitalization and even death. So not just a touch of the flu, something quite more severe and dramatic.
Yes.
Great, thank you, appreciate that. Dina, I'm going to turn to you now. This is the time of the year when flu vaccination campaigns kick off all across the region. Of course, we've got our own flu awareness campaign kicking off. Can you talk to me about which groups are at highest risk and which ones should really be focusing on getting the influenza vaccine?
Well, people with the highest risk of influenza are first and foremost the elderly, those over 60 or 65, and they should definitely take the vaccine every year as it's offered by their public health and health authorities. The second group that we would like to mention is maybe not such a traditional group, which is pregnant women. Regardless of in which trimester or which phase of the pregnancy they are. Vaccinating pregnant women gives an opportunity to protect a newborn child, but also it prevents, and that's the main reason, a severe influenza in last trimester, which can be quite severe in pregnant women because of the changes with their respiratory and circulatory system. The next group, of course, would be those that are chronically ill, those who are on therapies that impede with their immune system. Those that are anyhow having impaired immune system as an underlying cause of their or underlying part of their disease. And last but not least, they're not a risk group, but they are an important group. And these are the healthcare providers or the carers of those who are at risk. And by cocooning those at risk and providing immunization to those in close contact with them, we also organize or achieve a further protection.
Thank you so much. That's really important to know. So just to recap for our viewers, the elderly, pregnant women, people with underlying chronic conditions, and then an important not risk group, but group that can protect the people that they're caring for, health workers and carers.
Correct.
Great. Thank you so much. I think that really brings us to a fundamental question, which I want to go to before we start taking questions from our audience, and that is, does the vaccine work? We're telling people to get the vaccine, but what can we tell them about how effective it is? How well will it protect them against influenza?
The influenza vaccines, they do work, but they only protect against influenza. They don't protect against other respiratory infections due to other viruses. So that's the first thing. And the effectiveness, it varies from season to season, depending on which viruses are circulating and how well the match is between the vaccine, the viruses in the vaccine, and the circulating viruses. It also depends on the health status of those who receive it, and the immune system, and whether they're elderly or not. So there are several factors influencing the vaccine effectiveness. But overall, we on average, you can say that it prevents 40 to 50% of the infections, influenza infections, and it may even, if you get an infection, lead to a milder disease if you've been vaccinated.
Right. So maybe only 2 days a bed instead of 4 or 5. Thank you so much, Tyra. I'm going to go to a question now. We have a question from Judy McDermott in York, and she asks, can I catch the flu from getting the vaccine?
No, you cannot catch the flu from getting the vaccine. That's a myth. And that's because the vaccine virus strains, they are inactivated in the most commonly used vaccines, so they cannot give you an infection. There are some live vaccines that are used for children, but they are weakened the viruses, so they cannot kind of replicate inside your body. So you cannot get the disease from the vaccine.
Great. So Judy from York, no, you cannot get the disease from getting the vaccine. And that's an important thing to know. And also, I think something you mentioned that maybe most people aren't aware of is that there are different types or different strains of flu vaccine that circulate every year. So the vaccine only protects against some of them, correct?
Yes, that's right.
Yeah. So if you still get the flu, even though you got a vaccine, it doesn't mean the vaccine was ineffective. It just means it didn't necessarily strain that you unfortunately picked up.
Yeah, exactly.
Influenza is posing a little bit of a challenge. If we think about childhood immunizations like measles or polio, one gets the certain number of vaccines, 2 or 3 doses and some boosters in a life, and there is no need to do it every year. But it's because these viruses are not changing. Influenza virus is changing all the time.
Right.
And therefore our vaccines have to keep track of those changes. This is why we have new formulations every year. We have different formulations for the northern and southern hemisphere. So there is a lot of variability that's sometimes difficult to understand, but it's really to keep abreast with the changes that this particular virus poses to human mankind.
Great.
And that's always a challenge because for the northern hemisphere, the composition of the vaccine is decided by WHO in February, and a lot can happen with the viruses on the southern hemisphere before the influenza season starts again here. So
right, but we do our best, right?
Yeah.
Great. Thank you both so much. We have another question, this time from Copenhagen. And this is a good one, I think, for you, Dina, which is the vaccine safe for everyone? Safety is always a big issue when we talk about vaccines.
Safety is always a big issue. Vaccines are safe. They're made to be safe, but there is never a 100% guarantee. It's a very high safety profile. Influenza vaccines are not as reactogenic, meaning compared to some other vaccines, they don't create that much of local reactions or a slightly increased temperature.
Local reaction would be on the site
it's
of
a
injection,
swelling,
for example?
redness, a little bit tight skin,
Sure.
that kind of local reactions. So compared to some other vaccines, they are, as we would call, poorly reactogenic. There's some different types of influenza vaccines, and the ones so-called whole virulent vaccines, they are pretty much removed from the market. We are using the split and subunit vaccines, and these are really having a very good safety profile. The safety needs to be also seen with some characteristics of individuals. So the ones that have antibiotic allergy, or they may have some other allergies like egg allergies, may need some modified approach, but it doesn't mean that they can't receive the vaccine.
Sure.
They just need a more monitored approach to using those vaccines.
So that would be something you would want to tell your medical provider right up front before you got the vaccine, if you did have an allergy, for
correct.
example.
And also to report what may have happened
In
at
the
the
past.
last immunization, either with flu vaccine or some other vaccines.
Great, thank you. But the bottom line is they are safe for everyone.
They are safe, and there is a great effort being put to monitor vaccine safety.
Sure.
All countries, and in addition, in European Union, we do have some other more multi-country sort of systems for monitoring vaccine safety. Vaccines are a public health good, and therefore they're given to healthy people, and there is really a large effort to monitor any untold side effects and make a judgment what the next course should be.
Great.
And I think the influenza vaccines have been used for more than 50 years.
Right.
And because they're given annually, they've been given a large amount of doses. So there's a lot of experience with this vaccine, and the safety has been proven.
Great, thank you, Tyra. We have a question now from Ketty, and this one is, what else can I do to avoid getting infected? So I know you two are sort of experts in influenza vaccination, but I bet as medical doctors you have a few other tips that we can share with our viewers. What can you do to avoid getting the flu in the first place, above and beyond just getting vaccinated?
If I change the question slightly, what can a person who is infected help to spread it further? And this is to use disposable handkerchief, paper handkerchiefs, and throw them away into a container, to wash their hands frequently, to stay at a distance to other people, and also to stay at home when they are ill, and not believing that they should go and work because they are indispensable. But what can we individually do to protect ourselves from influenza? Well, one of the best strategies is really getting immunized. But the other one also, it's washing the hands and staying at a distance to people who are coughing and sneezing. They're very simple sort of things to do, and they apply not only to influenza, but to some other respiratory diseases.
Right, great. So remember to wash your hands. Tyra, anything to add?
Yeah, and I think mainly if you have small children, before you take them to daycare or in the daycare, wash their hands. And before you go home from the daycare, wash their hands. And when you come home, wash your hands. I think that's some good rules to take.
Wash your hands, wash your hands. Sounds like the mantra for flu season and really for any time, right? You mentioned children. That's a perfect segue into our next question, which comes from Clayton. And the question is, should children also receive the vaccine each year? Dina, would you like to start?
Different countries have different public health advice to their population, and there are countries in which childhood influenza immunization is part of their national program. These are being done generally on looking in morbidity and mortality, and therefore is being provided. It is safe in children. However, one should note that in younger children, they would require 2 doses of vaccine. It would certainly prevent getting children are in close contact, and it's rather difficult when they are playing and when they are with their mates in a school or a kindergarten to actually execute all of these prevention measures.
Right.
So they are probably at a higher risk of acquiring it. And they're also around elderly, their grandparents, and therefore they can spread the disease within their households. So providing the vaccine to children is also a very good strategy. It provides them with a immunological memory of certain strains that they've been immunized with. So The vaccines can be obtained after discussing with general practitioner, or they are obtained because there is a national program including children. But one thing that needs to be stressed, children who have chronic diseases are handled as any other person with chronic diseases.
Okay.
So they are entitled and should be protected as a priority.
Great. So children with chronic diseases, a definite yes. And children where there is, for example, a national program, you would encourage it. If it's there and it's
Of course.
available and encouraged by national authorities, you encourage it as well. Yeah. Great. So I'm going to move on to a question, and this one comes from Stephanie. And we've touched on this a little bit, but let's go back to it. What about health workers? How important is it for health workers to get immunized against influenza each year?
Yeah, I think it's very important because healthcare workers, they have a higher risk of acquiring influenza because they may get in contact with influenza patients.
Sure.
And the other thing is that if they get an influenza infection, they may transmit the disease to their patients.
Right.
If they have been to work with symptoms, or maybe a day before they had got their first symptoms.
Right.
So I think it's an important group to get vaccinated.
Yeah. Dina, anything to add?
And in particular, healthcare workers that are working with vulnerable groups, like newborns or prematurely born children, people working on oncology stations or in intensive cares, on respiratory units. Their patients are very vulnerable, and we very often have measures that prohibit visits by the family during the influenza season, and some other infection prevention control measures which are specifically instituted in influenza season. But healthcare workers have also the responsibility of protecting their patients as much as about protecting themselves.
Right. Great. Thank you. Healthcare workers, make sure you get immunized this season, I think is the bottom line from our two experts. I have a question now from Jane, and she asks, should I go to the doctor straight away when I first have flu symptoms? What's the expert opinion?
Well, depends, Jane, whether you do have underlying chronic diseases. But in principle, seasonal influenza is best treated at home. Staying at home, taking a lot of liquids, taking fever-reducing medications like paracetamol or a different medicine that would be provided to you by your healthcare provider. And staying at home and just getting over it. There is a saying that influenza will last for whatever 5 or 7 days, whether you stay at home or not. And whether you treat it or not, it just goes its cycle. And the best way of preventing other side effects of influenza is really getting this bed rest, taking a lot of fluids, keeping the temperature lower. And it's only if the symptoms get more severe, definitely do get in touch with your healthcare provider.
Great.
But if you belong to a risk group, then maybe it's a good idea to contact the doctor, because you can get antivirals that may prevent you from getting a severe disease. So, but the recommendation for antiviral medication may vary from country to country, but I think if you belong to a risk group and get flu symptoms, contact your doctor.
Great. That's really good advice. And I think it's important. You mentioned antivirals, but maybe for the audience, it's helpful to just get the reminder that flu, not to be treated with antibiotics, right? A lot of people think, oh, I feel really sick, I feel really ill. What I want is maybe antibiotics as the magical cure. Would that work in this case?
No, not at all. The antibiotics only have a place in secondary infections following influenza infection. So these are usually elderly patients that get a secondary bacterial pneumonia after influenza, and they would be benefiting from having an antibiotic treatment. But this is something this needs to be prescribed by a healthcare provider and is a part of the assessment of the individual. So it's only in those cases that antibiotics would have a benefit for the patient.
Great. Thank you so much. We have another question. This one comes from David, and he asks, is there a point in the year when it is too late to be vaccinated? And secondarily, if I get the vaccine too early, will it wear off? Tyra?
I think it's never too late to get vaccinated as long as influenza is circulating. And it takes 2 weeks before it is effective.
Okay.
But of course, it's best to get vaccinated early in the season, so you are protected throughout the season.
Of course.
There is some, the antibodies that you respond with to the vaccine, they will decline with time.
Yeah.
So you will not be as well protected at the end of the season as in the beginning of the season. But that's not a reason to kind of postpone vaccination. So I think get the vaccine at the start of the season, that's the best.
And I think that brings us to a slightly different question, which is why do people need to get vaccinated every winter? You just talked about the antibodies wearing off a bit. Can one of you talk a little bit about why it's necessary to get that flu vaccine each flu season, as opposed to just getting it a few times, as we do, for example, with other vaccines? Dina?
It's because the virus is constantly changing.
Right.
And while in a couple of consecutive years we may have one and the same vaccinal strain in the combination, generally they do tend to change over the time, and sometimes they can fundamentally change between the years, depending on what our surveillance systems are telling us, what is circulating, what are we finding within the population, what were the trends. And these are reviewed, as already mentioned, for the Northern and Southern Hemisphere separately.
Great. I have a fairly technical question, so I hope you are up to the challenge. This question is, does vaccine containing B Victoria strain antigens also provide protection against B Yamagata? So that doesn't mean a whole lot to me, but I'm hoping that you two experts will have more insight into what this questioner wants to know about.
There seems to be some cross protection between the lineages, and last season we saw where we had the Victoria lineage in the vaccine. It offered 30% protection against the B Yamagata, even though they were not the same lineage.
Interesting.
But of course, it would be better to have the Yamagata strain in the vaccine to prevent Yamagata. But there is some cross protection between the different lineages of influenza B.
Interesting. And this brings us to that sort of puzzle where we try to figure out what are the best strains to protect against each year. What are the strains we're most likely to need protection against? So I have another question for you, which is, if you actually get the vaccine and you do start to feel a bit ill afterwards, you shouldn't think that the vaccine wasn't effective, correct? You shouldn't let that convince you that the vaccine wasn't worth getting in the first place.
Well, there are many reasons why you can feel odd or not well after vaccination. One things are that some people react to vaccines with some generic symptoms. They might feel a little bit under the weather. As already mentioned, may have some local reactions. And that usually weans off within 1 or 2 days by itself. But there may be other events that simply happen at the same time. One may have caught another virus, a respiratory virus. One may be developing a different disease simply at the same point in time or soon afterwards. And just by the feature of happening after vaccination doesn't mean it's caused by the vaccination. And this is important to be mentioned, that we shouldn't jump to the conclusions that these side effects or conditions that we might be diagnosed with after immunizations are caused by the immunization. A nice thing to say is that very often children receive measles and rubella vaccine around the first year of age, and they shortly afterwards start speaking, but nobody would come to an idea that they started speaking just because they got a measles and rubella vaccine. It's simply the sequence of events.
Sure. So don't jump to conclusions about that.
Don't jump to the conclusions.
Great. Thank you, Dina. I think we have time for one more question. And this questioner asks, if you get vaccinated year after year, does that increase your protection against seasonal flu? And they want to know about whether it protects you against pandemic flu. Either of you want to take a crack at this one? So again, is there any kind of benefit to getting vaccinated year after year? Does that help increase your protection in any way?
Exposure to those viruses, and they're weakened viruses, gives an immune memory to those strains. Whether it's going to be sufficient to adequately protect you 20 years down the road if something similar occurs is difficult to say, because there are many factors that would interfere or sort of impede with the immune response. But certainly having a memory of encountering that virus is helpful. It might not be a complete protection, but it might, for example, provide you with partial protection and much less pronounced disease. So having these immunizations is a good investment if you want to. But the point with immunizations, they do leave a trace in your immune system. There is a recognition and a memory to exposure to those viruses.
Great. Thank you so much. Sounds like I'm coming down with a little bit of a cough now. So you know what I'm going to do? I'm going to go get immunized. I want to thank both of you so much, Tyra and Dina, for being here with us. And I want to thank all of our viewers for being here as well. If you have further questions, please don't hesitate to leave them on our Facebook page. We'll be very happy to answer them. And I want to thank you both. And I just want to ask finally, do you plan to get immunized?
I'm scheduled for vaccination next week.
Great. Dina, how about you?
The WHO Regional Office for Europe has a vaccination program for its staff every year, and it's just about to commence very shortly.
Great. I'll be getting immunized as well. So thank you very much for being with us today.